My name is Don Henderson. I'm from North Carolina, southeast of Monroe, North Carolina. And I want to talk about the wonderful, best medical center I've ever had the blessing to be in. And then I'll talk about the history of my cancer and how treatment went here and what's been done and the positive results that have come about. I came here for orientation. It's a 7-week program, first week being orientation, and I knew that Brio was different from any medical office I've been in. When I was out in the waiting room, got here a little bit early, talked to Dr. Goodyear from my first interview and assessment of my history and physical exam, and I noticed sitting in the waiting room there was a positive vibes. I could hear it. It's a very compatible waiting room. I sat down with Dr. Goodyear. I can remember the statement. Might be paraphrasing a little, but he said, "Don, we're here to treat you without harming you," and that's the truth. Anita took me around and showed me all different processes. I started on home, mainly just supplement for health, for immunity, build immunity. Started on that very first week. And then started full treatment plans on a technical second week that I was here. It starts, we get IVs, everyone gets IVs, and then you have a particular plan that treats you. You're treated as one person here. But the number of treatments here is about 18 to 20, and that's singly, that's not in combination. And there's a great success of helping people get cured of cancer and either move on forward with further treatments and supplements at home to completely defeat it. It's just, I can't say enough. I can't say enough for the doctors, Dr. Kim, the oncologist. I've had a couple situations where he's called me. I've called him on Sunday. He called on last Saturday to check on me, and he talks constantly with people, and he's a great oncologist, the best oncologist, and he made a statement to me in the beginning, orientation week, that I'm your oncologist for life, and I accept that. I'm gonna let me first of all now go to the history of my cancer. My PSA went up a bit in June of 19, and I followed up with a blood test again in September. It was 5.9, and so my regular physician recommended going to see a urologist. Took a biopsy, and had a high Gleason score. In the end, if I knew about this facility, I probably would have given a chance to defeat the cancer without. But that's history. I can't go back. There's a sign in there that says, "No, not tomorrow, not the future, but today," and that kind of applies to this. But so I went to a regular. My doctor sent me back to a urologist, and he was just very, very impersonal. Didn't seem to care. No empathy. He kind of smirkly said, "Well, Don, your cancer's back. Your prostate cancer's back." I asked him a few questions, and they wanted to start with procedures that were very detrimental to the human body and to life. I'll never go back to him again. And so this was this past August. My PSA went to 10 from a residual PSA of 0.4 for a year and a half. It had gone to 0.6 and 0.8, and I was trying to defeat it with eating better, more specific. But it went to 10. It may have gone to 10 anyway, no matter what I did. I can't go back. So I have a naturalist holistic doctor in Charlotte, North Carolina. And Dr. Andrea, I said, let's go ahead and get a PSA test before I go out so I know what it is when I come here. And it had gone to 30. Now, the great news is, because I believe personally, everything is synergetic here to work together. But Dr. Kim got the original biopsy of my prostate, and he did a test sent to the lab and got it back, and he found a 100% marker for angiogen blockers. So I have cancer drugs to take. Got glory to God. My right now my PSA is 1.74. That's actually from last Monday's blood work. There'll be BSA tests in here, and I just really believe it's going to be even lower. But Dr. Kim doesn't want to just settle on that. He wants to get it down to 0, and so do I. And I believe that we're going to do it. Continuing at home with medications and such as that. I also took ITP 3 times. It's low-dose chemotherapy, 1/10 of what the normal medical industry would feed you, which would be very damaging to the body. I believe those 2 things, it's my feeling that ITP, low-dose chemotherapy, and finding an exact cancer marker for the angiogen blockers to block the cells from getting the food they need are 2 major factors. Not to discount the vitamin C and everything else, but it's just, I just believe that's may have been the most effective, and I'm thankful for that. I'm continue on now, and they give you, when you leave after all your treatments, you're given a plan, and to go forward at home the rest of your life, really, to keep the cancer away. Some cancers, I'm sure, are a lot more likely to come back in certain situations, but my eating has changed. I'm changing it. You know, very little sugar, natural sugar, but this has been the best place that I've ever seen. If they just got diagnosed with cancer, I would say if you're able to, come here. The treatments here are natural. The ITP, the low dose chemotherapy is somewhat mainstream, but it's 1/10 of the load. I just got it 3 times when I was here. Don't jump into a doctor's regular mainstream doctor's diagnosis. Get a second opinion. Call up James Roberts here and get a free consultation about the plan, and they'll send you download you an email, and you can read a basic synopsis of all the treatments, and he'll inform you completely. Give yourself a chance. If you love life, you love your family, don't shortchange yourself. If you can possibly come here, I would highly recommend it.